The results of the study suggest that the longer the duration of dutasteride treatment, the more significant decrease in semen quality, and you're looking at metrics such as sperm concentration, semen volume, sperm motility, as well as the total motility and vitality indexes. You see, to truly understand the implications of this study, we would need a better defined control group and a clearer assessment of how changes compare with typical values found in a general population. This would provide a more complete picture of whether the dutasteride effects are minor anomalies or indicators of a potential decline in reproductive health. Recently, the internet has been set ablaze with a new study on dutasteride and fertility. This study is titled, quote, "Long-term use of dutasteride to treat androgenetic alopecia in young men may lead to persistent abnormalities in semen parameters, dutasteride and semen parameters," unquote, by Young J. Kim et al., 2025. But for the purpose of this video, I'm going to be calling this the Kim et al. Study. Now, the purpose of this study was to assess the impact of long-term dutasteride use on male fertility, as well as identifying a cutoff treatment duration that leads to significant and persistent declines in semen quality. Now, this study claims to be a, quote, single-center randomized controlled study, unquote, but in reality, it is a retrospective study in design. I know I'm at the part of the video where I'm just giving an overview of the study before I go into pointing out its issues, but this part I need to address right off the bat. So let's do some glossary work here. Let's try to figure out what some terms mean. The term prospective study design means that the research was planned and structured to follow participants forward in time from the point of their enrollment in the study. In such designs, outcomes are tracked as they occur after the initiation of the study, which allows researchers to directly observe and record data as events unfold, which can establish a clearer cause and effect relationship. So this study that we're talking about right now, the Kim et al. Study on dutasteride and semen parameters, right? It didn't do any of that. So this is why I'm saying it's retrospective in nature, meaning that the study looks back at existing data or patient records from the past. In retrospective studies, researchers analyze outcomes based on data already collected for other purposes, again, like medical records or other previous studies. And this can be useful, of course. It's not completely useless, right? But it will have some limitations. And researchers really have to be aware of these limitations, because if they're not, well, it will introduce a ton of other variables that they're really not controlling for. And it could also implicate maybe some selection bias, right? Since the data was not originally intended to answer specific research questions posed in the study. So, meaning the researchers could unconsciously introduce bias by cherry-picking people with certain values and thus bias the outcome of the research. After all, the researchers have to know a bit about the data already before they go actually picking it, even if it's randomized. So they could be picking more from a specific pool of data, for instance, and not looking elsewhere, which this study seems to have that issue because, well, spoiler alert, this study has no placebo control. Which also brings into question how well controlled this study is, because it's claiming to be a controlled study. So really, it isn't as controlled as it claims to be without that placebo control group. But we'll touch on this later on in the video. Just again, keep this part in mind about this Kim et al. Dutasteride semen parameters study. Anyway, looking deeper into the methodology, the researchers involved the records of 200 men treated with 0.5 milligram a day of dutasteride, placed into 5 separate groups, primarily grouped by treatment duration ranging from less than 6 months to over 24 months. Semen quality was measured before and 6 months after ceasing dutasteride treatment. Group 1 consisted of men who used 0.5 milligram a day of dutasteride for less than 6 months. Group 2 included men who used dutasteride for 6 to 12 months. Group 3 comprised of men who used dutasteride for 13 to 18 months. Group 4 contained men who used dutasteride for 19 to 24 months. and Group 5 involved men who used dutasteride for more than 24 months. The study kept various semen parameters to assess the impact of long-term dutasteride use on male fertility. These parameters are semen volume, and this measures the total amount of semen produced during ejaculation. This is an indicator of the function of the seminal vesicles and prostate. Up next, we have sperm concentration, and this parameter indicates that the number of sperm present per milliliter of semen. It helps assess the sperm-producing function of the testicles. In theory, that is, in theory, and we'll touch on this later why this wasn't necessarily a good metric to have. So we would conceptualize sperm concentration as the total number of sperm divided by the semen volume. Up next, we have the total motility, and this refers to the percentage of sperm that are moving. This parameter is crucial because sperm needs to be able to swim in order to reach a fertilized egg or move around. It has to have motility. Then we have the progressive motility metric, and this specifically measures the sperm that are moving forward in a straight line or in large circles, which is important for also effective fertilization. After that, we have sperm morphology, and this assesses the shape and structure of sperm. Normal morphology suggests a sperm shaped in a way that is likely to be able to fertilize an egg. We also have the vitality metric, and this indicates the percentage of live sperm in a sample. Live sperm are more likely to be healthy and capable of fertilization. And finally, we have DNA fragmentation, and this parameter measures the integrity of sperm DNA. High levels of fragmentation can indicate reduced fertility. The researchers also used the World Health Organization, also known as the WHO's standard of evaluating semen quality metrics. Now, the results of the study suggest that the longer the duration of dutasteride treatment, the more significant decrease in semen quality, and you're looking at metrics such as sperm concentration, semen volume, sperm motility, as well as the total motility and vitality indexes. The study indicates that treatment durations longer than approximately 18 to 20 months could lead to persistent impairment in these parameters. So let's have a look at some key metrics, right? So the semen volume exhibited significant changes across all groups in the Kim et al. Study. Initially, at the 6-month mark after discontinuation of dutasteride, Group 1, which consisted of men who used the drug dutasteride for less than 6 months, showed a relatively higher average semen volume, suggesting a quicker recovery or less impact from a shorter exposure. Now again, this is what the study is suggesting, right? Keep that in mind. It doesn't mean that this is actually the case. In contrast, Groups 4 and 5, which included men who used dutasteride for 19 to 24 months and more than 24 months respectively, demonstrated lesser improvements in semen volume, indicating potentially lasting effects from a longer duration of drug use. Sperm concentration across all groups showed minimal to modest increases after discontinuation, with no group showing statistically significant improvements. Here, I would say that this suggests that while the sperm concentration may not be drastically affected by dutasteride use, the changes are not necessarily reversed quickly upon stopping the drug. So really, the improvements observed were not statistically significant enough to tie it to the mere discontinuation of dutasteride. Next, the motility and progressive motility markers were other key parameters observed. Both showed improvements after the drug's discontinuation, with the earlier groups, so that's groups 1 through 3, showing better recovery compared to the longer groups, being groups 4 and 5. So what we can gather from this, pattern is that longer exposure to dutasteride, according to the Kim et al. Study, again, guys, relax, we're going to look at other studies too shortly, but what we can gather so far is that longer exposure to dutasteride may lead to more enduring negative effects on sperm motility. When it comes to DNA fragmentation rates, which indicate the integrity of sperm DNA, there was no statistically significant changes post-discontinuation, which tells us that dutasteride doesn't seem to impact the DNA integrity of sperm itself, which is a really, really good thing. Lastly, the study also monitored the vitality of sperm, which reflects the percentage of live sperm in the semen. Similar to other parameters, vitality showed only modest improvements after stopping dutasteride, with no dramatic recoveries noted in any group. So damn, this study shows us that dutasteride seems to have some long-lasting effects on semen quality after discontinuation, or at least after 6 months of discontinuation. It also shows us that there could be a possibility that the longer you're on the drug, the greater the impacts are on semen quality. But guys, don't stop watching the video here, because there are some major red flags and issues with this study, so stick with me here. So let's get some things out of the way, right? First, we need to understand that if you're coming to a fertility clinic, you're likely part of the population of men who have fertility issues, right? Full stop. Whether it's dutasteride that causes these fertility issues or something else, it's just the case that you are part of a population of men who could be dealing with a confluence of issues. Now, these issues could either be with the man himself, which, okay, yeah, that's one thing, that's one factor, or his female partner that is trying to get pregnant, or really both. Next, what I find to be strange about this study is the claim that it is controlled, again, like we said earlier, by what means? Remember, that lack of a placebo group of men who have not been exposed to any 5-alpha reductase inhibitors, such as finasteride or dutasteride, raises some serious questions about this study's design. You see, to truly understand the implications of this study, we would need a better defined control group and a clearer assessment of how changes compare with typical values found in a general population. This would provide a more complete picture of whether the dutasteride effects are minor anomalies or indicators of a potential decline in reproductive health. What I find weird is that because this study is retrospective in design, they have access to retrospective data at that clinic, meaning that the researchers could have easily have made a sixth group consisting of a population of men from that clinic who never used finasteride or dutasteride. At least this would give us some kind of measuring stick in which we can base and contextualize these findings from the Kim et al. Study. Even so, this would mostly be relevant to men within that clinic, or, if we were to expand it a bit more, men who go to fertility clinics. Again, these kind of men in and of themselves may have other issues besides the use of dutasteride. Honestly, a more interesting comparison group, in my opinion, would be, assessing people from the general population who have never used finasteride or dutasteride. So this would be healthy men, quote unquote. This too would have provided a baseline against which to compare the changes observed in the subjects exposed to dutasteride in this study. And without this sort of meaningful comparison group, either we get, men who haven't been exposed to dutasteride at that particular clinic, or men from the general population, it's challenging for us to determine if the observed changes are substantial or meaningful enough to actually affect fertility. So we're not talking about a question of statistical significance here, right? We're talking about the magnitude or the amount of change that we see in people that use dutasteride. Is it actually making a significant amount of change to cause fertility, right? You can notice in terms of statistics, you can have a statistically significant change, which means that we can tie the change itself to some sort of intervention, some sort of treatment. In this case, for example, you would say that the change to semen quality would be tied to dutasteride, right? For the example, right? But you're going to be talking about a factor of how much change was there, right? It can be a statistically significant change that was noticed in statistics where we can confidently say that it was dutasteride intervention that caused the semen quality to, decrease and become poorer. But in that same vein, that change might not be significant enough or large enough to actually make any sort of huge effects on fertility. Meaning that maybe people fall within normal ranges still while on dutasteride. So, yeah, it's causing a change, but in other words, it's not making a large enough change. So that's why it's important for us to have a placebo control group that didn't touch finasteride or dutasteride, because it allows us to know or have some sort of, gauge on the change from the norm. Finally, there was no follow-up for these men. So it could be the case that 6 months isn't enough time to show clinically significant as well as more statistically significant changes to semen parameters for all groups, right? Maybe it could be the case that, you need 12 months, right? That could be very well possible. And again, keep this in mind because we have other studies to check that kind of confirms this being the case. Because, guys, we need to remember that dutasteride has a long half-life, roughly around 4 to 5 weeks, meaning that once there is a steady state concentration in the plasma or the blood, right? And by the way, this is the amount in which the drug is absorbed being equal to the amount in which the drug is cleared from the body. So once this steady state concentration is met, the drug can remain in circulation for an extended period of time, even after cessation. You got to realize it's being absorbed into tissues, right? It's having action in those tissues. It's going to be there for, quite some time. As a result, it can take both serum and tissue DHT to return to pre-treatment levels. This prolonged suppression was illustrated by Olson et al. 2006 in a paper or study titled, quote, "The Importance of Dual 5-alpha reductase Inhibition in the Treatment of Male Pattern Hair Loss. Results of a randomized placebo-controlled study of dutasteride versus finasteride," unquote. In that randomized trial, human subjects taking dutasteride at 0.5 milligram per day achieved roughly 92% suppression of serum DHT at 24 weeks, or around 6 months, and, for many, DHT remained substantially below baseline for several months after the medication was stopped. To give us an idea, when it comes to the 0.5 milligram dosage of dutasteride per day, it took a median of 86 days to merely bring serum DHT back to within 25% of baseline values. So just to get within 25% of what you had before you started dutasteride at the beginning of the study. And the crazy part about this is, when you look at the range, right, it tells us that it could take between 71 to 307 days, meaning that there were some subjects in this study who were exposed to dutasteride for 0.5 milligram per day, right? It took them 71 days for that to come within 25% of their original values of DHT before they even started the treatment. And when it comes to the outlier, right, they took 307 days. When looking at higher doses, such as 2.5 milligram dutasteride, it took an even longer median interval of 155 days, with the range between 72 days upwards to 421 days. So guys, it took a median of 86 days just to be 25% of what the original DHT values were for humans in that study. And mind you, again, this is on a 0.5 milligram per day dutasteride dose. Look, the prostate is rich in 5-alpha reductase enzymatic activity, so the inhibitory effects from dutasteride on it might take a while for tissue DHT to build up. And this is hard to do if dutasteride is still in the system and tissue after 6 months of discontinuation, which means, logically, the suppression of semen quality may continue. Later, we will talk about this and why this might not be the case, but in any case, this just goes to show you that you might need longer than 6 months to see improvements in semen quality, especially after discontinuation or with continuous use. So, as dutasteride reduces in the system, it will cause less suppression effects. At least, that is what the medical literature shows us. So with that, we may say that the findings from the Kim et al. 2025 dutasteride semen study may show us that tissue level suppression of DHT may continue well beyond the nominal 6-month window often used in clinical follow-ups, which helps us explain why men on long-term dutasteride might show delayed or incomplete recovery of semen parameters if measured too soon after discontinuation. So, taking dutasteride pharmacokinetic properties into account, like its long half-life, the researchers should have kept following up with these men beyond 6 months, and who knows, maybe they have that data. So it's kind of weird. It is retrospective, remember, right guys? We don't know how in-depth these patient records are. Maybe these records show that these men all sired children. Maybe they can talk about the method. Did they use IVF? Like, what happened, right? But all I'm saying is these records might very well have, beyond 6 months data, right? So this is where, that whole retrospective limitation might come into play. Like, how are they going about sourcing this data? There could be a significant amount of bias here. So yeah, maybe they should have referenced medical literature a bit more before they came up with this specific metric and follow-up, right? I mean, the lack of a follow-up is bad in and of itself, but 6 months is too short of a window for a study like this. They should have expanded to 12 months. Maybe they should have had another 6 months of follow-up to see what really happened to these men. All I'm saying is we have too many questions here for this study to be that reliable in its outcome. So we're actually going to be looking at another study by Amory et al. 2007, and this study focuses on dutasteride and semen parameters. However, it's better designed than the Kim et al. Paper that we were just looking at. Published in 2007 in the Journal of Clinical Endocrinology and Metabolism is the paper titled, quote, "The effect of 5-alpha reductase inhibition with dutasteride and finasteride on semen parameters and serum hormones in healthy men," unquote. So when looking at the methodology of this study is a randomized, double-blinded, placebo-controlled prospective study. So this means that when it comes to it being randomized, the participants are randomly assigned to either treatment group or the control group. And randomization helps eliminate selection bias by ensuring that each participant has an equal chance of receiving any of the interventions being tested, whether it's finasteride, dutasteride, or even just a placebo pill that has nothing in it. This process helps to evenly distribute known and unknown factors that might affect the outcomes across different groups. In a double-blinded study, neither the participants nor the researchers know who is receiving the actual treatment and who is receiving placebo. And guys, again, remember, a placebo is a substance with no therapeutic effect. So it could be a simple sugar pill or a pill full of water. And this prevents both parties from being influenced by their expectations or biases about the effectiveness of the treatment, which can affect the behavior and assessment of outcomes. Placebo-controlled. So we already touched on this, but this term tells us that the effects of the medical treatment are compared to the placebo. So in this study, we have two treatments, right? Dutasteride 0.5 milligram and finasteride 5 milligram. And the placebo is being used as a benchmark to measure how effective the experimental treatments, or the treatments in general, in this case, the fin and the dut, is beyond the sort of psychological effects of simply receiving a treatment. And this is crucial when it comes to determining the true therapeutic effects of the treatments, because some patients may experience improvements simply because maybe they believe they're getting a treatment, and that might lead them to, taking care of their hair better, for instance. So again, the expectation of receiving a treatment is in and of itself capable of generating a placebo effect. And finally, prospective. A prospective study is one in which participants are followed over a period of time to observe outcomes. So when it comes to this clinical trial, or any prospective clinical trial that is, we look at patients from the point where they're enrolled in the study, where they haven't received any sort of treatment yet, all the way through the study where we're tracking them, and the interventions we place on them, and towards the end of the study where we see, what happens, the outcomes, right? As opposed to the Kim et al. Study where we were looking at before in the beginning of the video, or the beginning of the segment, however I cut this up. That study was retrospective, so that means they went back into the archives, looking at old patient records, and that's where they got their data from. So this study, overall, this Amory et al. 2007 paper on dutasteride semen parameters is a very robust and reliable study, and it doesn't have that much, room for bias. So when comparing it to the Kim et al. Study, this one blows it out of the park. So in this study, 99 healthy men, all with normal baseline semen parameters, were randomly assigned to receive either 0.5 mg per day dutasteride, 5 mg per day finasteride, or a placebo pill that had nothing in it. They remained on their assigned treatment for 52 weeks and then discontinued it for an additional 24 weeks. So overall, this study went on for 1 year and 6 months. As opposed to the Kim et al. Study, they only looked at 6 months' worth of patient records. Anyway, going back to the Amory et al. Paper, semen parameters were measured at multiple time points. At baseline, halfway through the treatment, so 26 weeks into the overall study, and at the end of the treatment, 52 weeks, or 1 year. And also, after the formal study was completed, the treatment phase, they also looked at after 6 months off of the medication itself. So there was an additional 24 weeks, like we stated before, where they kind of monitored these men to see what was happening with their semen after they were done using the medications for a year. During the first half of the therapy, those on dutasteride showed moderate drops in several measures of semen quality. At week 26, their mean total sperm count was 28.6% lower than that of baseline, while finasteride users experienced a 34.3% decrease, which is kind of crazy because you would expect dutasteride to be more potent in this case and have a larger decrease than finasteride. But as you can see, that wasn't the case. Now, it might be due to dutasteride having a long half-life, so maybe, finasteride works sooner at reducing those semen parameters. But also, the differences observed might also be due to some statistical variation within the study sample. So small variations in the response of different individuals to medications can actually lead to different outcomes at specific points in time. But also, if the subgroup of participants randomized to the finasteride group had marginally different baseline characteristics concerning semen quality, this could skew the comparative results, especially over shorter intervals. So that's probably why we're seeing that sort of difference in the dutasteride and finasteride sperm count. At week 52, or 1 year into the study, users in the dutasteride group experienced a decrease in total sperm count that was not statistically significant when compared to baseline. So, in simpler terms, by week 52, or 1 year into the study, those using dutasteride experienced a small enough decrease in their sperm count that it could not be definitively attributed to dutasteride. It could be due to something else. So, this means that while there was a noticeable drop in sperm count among the users, the change wasn't strong enough to clearly be separated from what might just naturally occur or happen by chance. So, they really couldn't say that dutasteride was the cause of this sort of difference or variation. This reduction in total sperm count from baseline with dutasteride treatment was 24.9%. And you guys have to understand, right? That sounds like a large number, but realistically, your sperm count is always going to be fluctuating throughout the year and at any given point in time. That doesn't mean it's due to dutasteride per se. Surely enough, we did see fluctuations of sperm count in the placebo group as well. However, it was not large enough or statistically significant enough for us to state that, these changes were due to the placebo. Likewise, we can say the same thing for dutasteride towards the end of the study, and as well as finasteride. We cannot necessarily say that these differences were large enough to attribute it to, respectively, finasteride and dutasteride. It did not meet statistical significant inferences. So what does that mean? Well, with continued use in a 1 year period, the dutasteride treatment group and the finasteride treatment group, the sperm count got better over time. So let's go on to sperm motility. Sperm motility declined about 6% to 12% across both finasteride and dutasteride groups throughout the study. This was also observed in the post-therapy follow-up, indicating that motility was somewhat slower to rebound, but nevertheless it was rebounding. So there was a recovery of sorts. Semen volume also declined in the dutasteride users, decreasing by 24% at week 26, or 6 months into the study, and by 29.7% at week 52, or 1 year into the study. However, it did show improvement by week 24 in the follow-up period of the drug. So after the 6 months they got off the drug, there was improvement. There was only a 16.8% deficit from their baseline. However, guys, these drops, though somewhat statistically significant at certain points, did not push most participants below the typical fertility thresholds. Again, remember, we can have something that is statistically significant, but statistical significance doesn't mean that there was a large difference between the groups, right? Something can be statistically significant, yet that difference can be very minor. It just means that we can tie that difference or the change that occurred to our treatment intervention or some intervention of some kind. And in that context, that intervention again would be dutasteride or finasteride. So in other words, yeah, it is causing a change to the semen quality, but that change isn't large enough to make you infertile, unless you have other issues that you're dealing with, and we'll touch on that later on in the video. Anyway, looking at the study, only 5% of men in the finasteride or dutasteride groups experienced a drastic drop to less than 10% of their starting total sperm count, and this accounted for 1 man in the finasteride group and 2 men in the dutasteride group. And even those individuals partially recovered after discontinuing treatment. And guys, we've known this for decades, right? This new Kim et al. Study isn't telling us anything new, right? There are some people who are going to be more sensitive to 5-alpha reductase inhibitors. But the perception that this thing is going to make you infertile over time? No, that's not true. From the Amory et al. 2007 paper, it is clear that the impact of dutasteride on semen quality is generally temporary and not severe enough in most men to threaten fertility. During the 52-week on treatment period, men did exhibit decrease in total sperm count, motility, and semen volume, but these values improved over time, sometimes even while the subjects were still taking the drug. So with continued use, things do get better. By 6 months off treatment, most participants, the majority of participants, saw most of their parameters rebound further, although sperm motility recovered more slowly than total count or volume. Crucially here, Amory et al. Included a placebo group for direct comparison, which underlines that the declines, though they were statistically significant, right? That word again, right, guys? It tended to keep men within or close to normal reference ranges for fertility. So by having that placebo group, it helps us keep things in reality, right? There was a change, but that change again was not huge enough to make you infertile. I keep stressing this, but it's important given how this new Kim et al. Study is making everyone freak out. When we look at that Olsen et al. 2006 paper, it helps us explain the biology behind this partial and gradual recovery. Its data, that Olsen et al. Paper that is, shows that dutasteride at 0.5 mg per day suppresses DHT levels by roughly 90 to 92% at a steady state concentration, and many men do not return to baseline DHT values for over 3 to 6 months after discontinuation. We also know that dutasteride reduces prostate size. Now guys, I'm not able to find a study that shows the reduction in prostate size in men without benign prostatic hyperplasia or prostate cancer, but from such trials we know that dutasteride reduces prostate size by 28%, as we can see in the study titled, quote, "The Effects of Dutasteride, Tamsulosin, and Combination Therapy on Lower Urinary Tract Symptoms in Men with Benign Prostatic Hyperplasia and Prostatic Enlargement, 2-year results from the COMBAT study," unquote, by Rohoborn et al. 2008. Similar reductions might happen in healthy men, as the prostate is rich in 5-alpha reductase enzymes. With this in mind, semen volume is inevitably affected, given that prostatic fluid, right, the fluid that comes from your prostate, is a major component of ejaculate. Prostate tissue size does not regenerate overnight, guys, right? So restoration to a full prostatic volume or getting a larger prostate after treatment, especially on dutasteride, can take easily more than half a year once drug-induced suppression stops. So if we're seeing from the Olson et al. Paper that dutasteride can linger in your body for 6 months after discontinuation, well, that means it still has, effects on your body. It's still suppressing DHT to some extent. So you have to wait for this thing to significantly leave your system and leave your tissues for things to rebound. And only then can things start to rebound, at least in a more uninhibited kind of way. It takes time for the cells in any tissue to divide and grow after all. So that means it takes time for the prostate to return to its normal size and thus for the typical volume of prostatic fluid to be created. With this in mind, we should know that semen is composed of fluid from multiple sources, including roughly 20 to 30% from prostatic fluid. So all in all, a smaller prostate means less prostatic fluid, which can falsely appear as a dramatic drop in total sperm output if a study reports only sperm concentration and overall semen volume. And guys, spoiler alert, right? That's exactly what the Kim et al. 2025 paper did. This, again, recent paper that everyone's freaking out about. They only ever used sperm concentration over sperm count. And this is very bad as a metric because if the volume is the parameter that's most impacted, which we likely know it is because a smaller prostate means less prostatic fluid, right? Then measuring concentration alone can give you a misleading impression of how many sperm are actually being produced. For instance, a man might be generating nearly the same number of sperm in his testicles, right? That's where sperm is made, guys, by the way, right? Sperm is made in the testicles. But because the prostate is temporarily providing much less fluid, the final semen volume is lower. And as a result, even a modest reduction in absolute sperm count may look larger than it really is when viewed through the lens of sperm concentration per milliliter. And maybe the Kim et al. Study didn't have access to total sperm count, right? Maybe the clinic itself only reported sperm concentration, which would be kind of weird to leave out sperm count, but whatever. But had they routinely reported total sperm count, the reduction in actual sperm production might not have appeared quite as dramatic as the sperm concentration metric may lead you to believe. And it would be easier to separate the effect on prostatic fluid volume from any true impact on spermatogenesis. And that's your capability of producing sperm in your testicles. Because the implication here from the Kim et al. Paper is that dutasteride is negatively impacting spermatogenesis, or your testicles' capability to produce sperm, when in reality, they don't even prove that at all. In fact, the Amory et al. Paper, at one point in their study, said that spermatogenesis isn't really being impacted. They state that testosterone alone is typically sufficient to maintain qualitatively normal spermatogenesis. And by the way, they reference other bits of literature too to back up this sort of claim, right? And I've mentioned this before in other videos, but I'll say it again. When looking at a hormone and its importance, it isn't only about how potent it is in the sense of its affinity for a receptor or its dissociation rate, as we see with dutasteride and the androgen receptor, right? We need to take into account what genes this hormone is activating. And when testosterone and the androgen receptor come together, they form something called a dimer, also known as a complex. And when this complex goes into the nucleus of a cell, right? So when it goes into the germ cells of the testicles, it enters into the germ cell's nucleus, right? And the nucleus has the DNA, and the DNA is the instructions for what happens, right? So there, testosterone and the androgen receptor complex goes to certain segments of the DNA that is responsive to androgens. It's called androgen response sites, or androgen activation elements. And it is there, testosterone activates the genes that are responsible for creating sperm. And guys, this is typically done and associated with testosterone and not DHT, even though DHT can do the same thing. So logically speaking, 5-alpha reductase enzyme inhibitors shouldn't be impacting the literal creation of sperm. Therefore, sperm count should stay relatively normal unless a man is hypogonadal, meaning that they don't produce enough testosterone. Then that is an issue with the individual and not the drug finasteride or dutasteride. Because we know it actually increases testosterone, right? If you don't have free testosterone turning into DHT, that means you actually have more free testosterone. So if you're hypogonadal and you're not producing enough testosterone in your testicles or from your adrenal glands as well, then you're going to have issues with your fertility. You can read more in the paper titled, quote, Androgen Physiology, Receptor and Metabolic Disorders, unquote. So with all of this in mind, all the studies we just looked at, right? When the Kim et al. Paper 2025 observed that men on dutasteride for longer than 19 or 20 months did not return to baseline semen volume or motility within just 6 months off the drug, we can either say that these men need more time, or perhaps they might be part of a population of men who had pre-existing issues, right? But all in all, what we can really say based on the design of that study, right, is that within just 6 months off the drug, these men didn't return to full vitality, right? Which could mean that maybe they need a bit more time. And given the literature we just poured over, right? In all likelihood, these men just need a bit more time. The absence of further follow-up in the Kim et al. Study means that we cannot know if additional time might have resulted in the steady rebound seen in the Amory et al. 2007 paper. But once more, the Kim study's failure to include a placebo or a never-exposed control group to dutasteride and finasteride also weakens its conclusions, since it is possible that other factors other than dutasteride contributed to the mild infertility parameters in certain individuals, particularly those recruited from the fertility clinic setting. Even so, the real takeaway from all of this is that also another real takeaway here would be that tissue growth, as seen in the prostate, or endocrine normalization, as seen in the amount of time it takes for dutasteride to leave the body and for dutasteride to come right back up, as we can note in the Olsen et al. Paper, all of this requires time. And the 6-month window that Kim et al. Used might not just be enough time to see these gains, especially when it comes to metrics of the semen volume, right? Because prosthetic tissue takes time to recover, right? And it doesn't mean that the longer you're on dutasteride, the smaller your prostate gets over time. There will be a point in which the prostate just stops getting smaller. However, you need time for that prostate to recover and get bigger in size when you're off treatment. And maybe then your semen volume might go up. But we know from Kim et al., even the men who continue to use dutasteride, their semen volume kind of went back up over time, especially in those who discontinued. And we can say those results are more reliable than the Kim et al. 2025 paper because in the Amory et al. 2007 paper, they had a placebo control group. They had clearer data. We had something to measure against, whereas, again, Kim et al. Didn't. Honestly, if the Kim et al. Paper had a follow-up parameter beyond 6 months, I would argue that we would see a recovery in those men's fertility ranges, right? But they didn't have a follow-up. So, taking that context along with what Amory et al. 2007 and Olsen et al. 2006 shows us, it's likely that any dutasteride-induced reductions in semen quality are transitory, and they aren't significant enough to cause infertility, right? So people can still have kids while taking dutasteride or finasteride at that matter. And if they are to get off of treatment, right, maybe wait 6 months or a year, I think a year would be too long, whatever, but it's you who wants to make the family, right? If you get off of treatment, these qualities will rebound. These semen parameters will get better. But the real issue here, right, guys, is that men who have hypogonadism, so their testicles aren't producing enough testosterone, you guys shouldn't be on any 5-alpha reductase inhibitor drugs, right? You guys shouldn't. You should go get this issue solved first. Possibly using human chorionic gonadotropin, or HCG, which is a common treatment for men with hypogonadism. HCG works by mimicking luteinizing hormone and thus stimulates your testicles to produce more testosterone. This typically results in the testicles increasing in size and also improving spermatogenesis, as we can see in the study titled, quote, "The effect of human chorionic gonadotropin therapy on semen parameters and pregnancy rate after varicocelectomy," unquote, by J. Babak et al., where in this study of 118 infertile men randomized into two groups, it showed semen analysis in the group that took HCG improved sperm count metrics and overall semen quality. We also have another study titled, quote, "Changes in semen quality and fertility in response to endocrine treatment of subfertile men," unquote, by Z.T. Homani et al., where HCG improved 117 subfertile men who saw their semen quality improve. Finally, the study titled, quote, "Human chorionic gonadotropin HCG, a treatment for oligospermia," unquote, by Mustang et al. 2007, showed in, albeit a smaller study of 17 patients, semen quality improved after HCG administration. So if you have hypogonadism or, other issues adjacent to that, then maybe HCG might be a solution for you, but go talk to your doctor if you have that problem. Anyway, guys, hopefully all of this has been put to rest. This new Kim et al. Paper 2025 that everyone's freaking out about. Guys, it's a nothing burger. It's a huge red herring. Had they followed up more in the study, had they looked at the retrospective data, and I'm kind of, real quick, I'm kind of shocked, right, that the patient records didn't have anything beyond 6 months, because if it did, then why didn't they include that in the study? Kind of odd, right? But this is the problem with some retrospective studies, right? It leaves a lot of room for bias and, some huge limitations, because had they taken into account the long half-life of dutasteride, maybe they would have noted that, maybe we should have a follow-up period, maybe, another 6 months to see what's actually going on with the semen parameters in these men. Or maybe they couldn't do that because these men were already out of the clinic and it would be too hard to find them, right? So the external validity factor here is greatly, messing with the Kim et al. Paper. In any case, dutasteride is safe. It's not going to make you infertile. The real issues of infertility is with having hypogonadism or other sort of defects to your testicles, which dutasteride isn't causing, right? And you have to go get that checked outside of 5-alpha reductase use. Go get your fertility checked if you're looking to have kids. And if you're concerned, you can always come off the drug, 6 months, as we see in Amory et al., the semen parameters, it goes up and, you'll be fine. So good luck having kids. I would say maybe screen for genetic issues that you and your partner, you might be carriers for some kind of disease. That's also important too. You should screen for that so you might know your chances of having a kid with that particular ailment or disease or syndrome or whatever. So that can inform you whether or not you want to have that child or have any children, or it might inform you on how to, treat the child if you are to have them. So it gives you an idea of your odds of having a kid with a specific issue. Anyway, go do your genetic screening, go do your fertility tests, continue to use your, dutasteride and finasteride to keep your hair, and if you want to, get off of it to go have a kid. But if you're bald, that might be a limiting factor for some of you guys out there. But in any case, you know what I mean by that. In any case, thanks for watching this video, and I hope to see you in the next one. Peace out, guys. I'm done talking. I need some water. Bye.